So the ECOG trial for smoldering multiple myeloma is a very interesting trial. We just plainly compared observation, which is standard of care for smoldering myeloma, with lenalidomide at full doses. The trial probably would not be designed the same way if we were to decide on how to do it now, but it was designed and implemented in a different era when single agent lenalidomide or a doublet therapy was standard for multiple myeloma. Now we are in the era of combinations. And there is also data from the Spanish group that lenalidomide delays progression to myeloma and in fact improved overall survival in the Spanish trial. In this trial, the goal was really to prevent the progression to active myeloma, and the trial was positive in that it showed that lenalidomide could do that. So there are a lot of consequences to having active myeloma, which kind of creeps up on the patient when they have smoldering myeloma. And the major consequences are those of tissue damage, bone destruction, compression fractures, pathological fractures, renal failure, anemia, quality of life decrement, all that. Unfortunately, you can also combat that with more active observation. That's one thing. And philosophically, many people feel that smoldering myeloma, being a less aggressive form of myeloma, so to speak, could be addressed as if it was myeloma with the same intense approach that we use for regular myeloma. And in that case, the overall results would be much better. So the criticism or the commentary on this trial would be that one could have treated smoldering myeloma, especially high-risk smoldering myeloma, in the same fashion as you would treat myeloma and put it away for a long time. B, that lenalidomide for 2 years is too little treatment given the era of combination agents up to quadruplets that we are using nowadays for multiple myeloma. And C, that the standard arm or the control arm, again with closer observation, would be a surrogate for many patients. So you would end up treating a lot of patients who necessarily don't progress in that interval. And more interestingly, in this study, it showed that African Americans who were on this trial did not actually get the benefit of lenalidomide, which is pretty surprising, which either most likely speaks to the fact that smoldering myeloma in that population may not be as aggressive as smoldering myeloma in the other populations.